This recording is for Chapter 16, Mental Health Nursing Eating Disorders, and the PowerPoint is coming from the textbook entitled Introductory Mental Health Nursing by Cynthia Chinchillo. All right, let's dig right in. So, eating disorders. So, I want you to think about eating, and we need to eat in order to stay alive. Think about food as fuel for the body, and that's going to be a reoccurring theme that you're going to hear me mention, especially for your patients that have eating disorders. So, let's jump right in. So social media really places a lot of emphasis on different body styles and what is quote unquote the appropriate body type or the attractive body type. There's a lot of body shaming that happens online. And that's why it's so harmful when our teenagers or younger, even younger than teenagers, get on social media because they have this negative influence and they don't have the tools in order to process what this means, and they don't have the tools in order to kind of compartmentalize or to, not absorb these negative feedback that they see on social media. So it's really important that we educate our parents, that we educate our young people about these dangers and try to stay away from body shaming and stay away from these negative things on social media. So the perceived idea is that, okay, we have to conform to one type of beauty, right? And that, is not necessarily healthy, right? Everyone has different body styles, different background, different makeup. So, but that's what happens a lot of times with social media. We see this body shaming, this bullying. Sometimes individuals are not able to determine, okay, well, what's realistic? What is normal as far as health wise? Okay. And then they end up with this disturbance, and they have this dangerous eating pattern. They're not consuming enough healthy calories in order to gain weight or maintain a normal weight, especially if we have younger patients that we're talking about. They need to eat in order so that they can grow, right? Their brains are still growing, their muscles are still growing, their entire body's still growing. So that's a very important point. So we're going to talk about 3 common eating disorders: anorexia nervosa, which is usually just called anorexia; bulimia nervosa, which a lot of times you hear just called bulimia; and then binge eating disorder. So let's take a look first at anorexia nervosa. So this is an eating disorder characterized by an individual who loses weight either by restricting calories or excessive exercise. They have an inappropriate weight for their age and stature, and they have a distorted body image. In your textbook on page 274, it talks about anorexia nervosa, and it does give you the signs and symptoms. And so this individual with anorexia nervosa has an extreme fear of gaining weight. And the fear of weight gain is not relieved as the individual experiences weight loss. The fear may even intensify as weight loss accumulates. When the individual reaches a weight that is below the standard for their age and stature, they continually to mentally visualize themselves as overweight and continue their quest to lose more weight. The behaviors the individual uses to achieve weight loss categorize anorexia nervosa into one of 2 subtypes: restricting or binge eating or purging. Okay, so let's talk about binge eating. Okay, so binge eating or binging is eating an unusually large amount of food, usually within a 2-hour time frame. That is more than most people would eat in a similar circumstance. Purging is the eliminating of food consumed through self-induced vomiting, okay, and with the excessive use of laxatives or diuretics. Most individuals with anorexia who engage in these binge eating also follow up with purging. So what's going to be important to note as the nurse for this kind of patient is, okay, what does their skin look like? What does their hair look like? What do their nails look like? Because anorexia nervosa may cause individuals' hair and nails to become brittle, fragile, and easily broken because of the lack of essential nutrients. The other nursing intervention is that, okay, after mealtime, we need to watch this patient. At least 1 to 2 hours after mealtime, we need to watch them because they may go and do this binge of this purging behavior. They may exercise excessively. So we really need to make sure that we are watching this patient very carefully. So this person or this patient that has anorexia may tend to be very quiet and shy and maybe even hypersensitive. They may be really sensitive to feelings of rejection. So in a mental health setting, as a nurse in general, we should not criticize our patients or reject them. So we should be matter of fact and stick with the facts and maintain a neutral kind of stance and a neutral conversation. Because if we come across as rejecting the patient, that can create an issue where they can be triggered, or they can revert back to behaviors, or they can lose the progress that they have made. So what's important when you're dealing with this patient that has anorexia? You want to make sure that they have autonomy and they can control what they eat. So you don't want to force this patient to eat anything, but you can also remind them to consider the food as fuel for their bodies. That's going to be an important thing that you can do. So let me bring this pictorial over for a moment, because I think this is important for you to kind of see what this patient that has anorexia sees. So they have this fear of obesity. They feel that they're overweight or they weigh too much. And in reality, they are very thin. So here we have an image of a patient with anorexia looking in the mirror, and what we see is someone that is emaciated, the ribs showing. They may have amenorrhea because their body is not able to sustain a developing fetus. They will have brittle hair, dry skin, brittle nails, right? They may have cold intolerance. They may exercise excessively. But in their mind, they see someone that is overweight. So that's really important to note when we're dealing with this patient. Okay. All right, so let's continue and let's look at our patient that has bulimia. So this is a binge eating disorder, okay? And when we say bulimia nervosa, a lot of times we'll just say bulimia. The individual either binge eats or regularly overeats and then uses self-induced methods such as vomiting or the use of laxatives to counteract food that's consumed. Individuals with bulimia nervosa often report a feeling of being out of control during the binge eating episode. Those with bulimia nervosa typically do not have a distorted body image that is seen with anorexia nervosa. In fact, those with bulimia nervosa often recognize that their eating is abnormal and report feelings of guilt, anxiety, or shame regarding their eating and the food consumed. However, the binge eating and purging that is seen in bulimia nervosa can be seen as a subtype of anorexia nervosa. So the individual with bulimia nervosa is typically within a normal weight range for their height and their age, and which is different from that patient that has anorexia. Okay, so when we look at this patient with bulimia, some of the things that we see is that they will binge eat. And so maybe the patient's coming home from the grocery store with all their groceries, they pull over the side of the road and they just eat everything that they just bought in 20 minutes. So while the patient is eating, they have a feeling of euphoria. They're like, wow, this is really great. I feel good. And then afterwards, they look at all the wrappers and then they have a feeling of guilt and shame. Okay, of guilt and shame. And that's when the purging comes in, or the compensatory methods, which can be laxatives, diuretics, or enemas. They use to counteract the amount of food that they have consumed. Now, typically these episodes occur on average once a week. There is a lack of control or inability to stop eating during this binging episode. Now, the type of food that they consume varies, but typically it's an indulged craving for high calorie, sweet, or carbohydrate rich foods such as pastries, ice cream, cakes, pizza. Rapid hidden consumption of food is typical with continued eating despite uncomfortable feeling of fullness. This individual with bulimia nervosa usually consumes more calories during a binge episode than those without the disorder consume in an entire day. Okay, so if it's based on your height, your weight, your age, if you're supposed to get maybe 2,000 calories a day, an individual that's having a binging episode, they will eat at least 2,000 calories or more during this binging episode. All right. And so this is really significant. Now, these individuals, they're usually ashamed of their eating problem and attempt to hide their behaviors. Binging usually occurs after a depressed mood state, including stressors, periods of restrictive dieting, or negative self-talk about body image. Okay, so this is really significant to identify in your patient. Okay, so signs and symptoms of bulimia. So binging with the inability to stop eating, craving for high calorie or sweet foods, consumption of many calories in a binge, shame about eating problem, attempting to hide food consumption, depression, negative self-image, repeated use of induced vomiting. And this is something that's important because as a nurse, you'll see your patient, they may have damaged or discolored teeth because of the excessive vomiting. That hydrochloric acid from the stomach has now damaged the enamel on the teeth. So sometimes dentists are the first one to observe that the patient has a potential eating disorder. Also, the patient may have scars on their knuckles from sticking their fingers to the back of their throat to induce vomiting. So that's another kind of telltale sign that you can see. And these are the kinds of things that you need to know for your NCLEX questions, because they will paint a picture of this patient and you should realize that, okay, the patient has these scars, they have discolored teeth, right? So these are, red flags that alert me to, okay, this patient may have an eating disorder. So always remember those clinical cues, okay, what they mean, and the nurse is supposed to be able to, number one, assess, find these clues, and then understand what those clues mean. So some other signs and symptoms of bulimia is they have an outward preoccupation with food. They may stash food. They may have personality anxiety disorders. They may leave the table frequently during a meal to go purge, right? So we need to be aware of this. And if you have a patient, as a nurse, if you have a patient that has an eating disorder, they really need to be monitored very closely during meal times. Okay, so let me bring this pictorial over of a patient that has bulimia. And so you'll see again, this binge eating, they're hiding. It's kind of a shameful kind of thing. But while they're binging, they have this feeling of euphoria, right? So we really need to, again, be aware and be able to identify that in our patients, okay? So this is a great visual. We have these high calorie snacks, donuts, potato chips, sodas, and so they generally sleep after eating. They may vomit, use laxatives, okay? So all important concepts to understand, all right? And the binging does not stop when they are full. Okay, so you may be wondering, okay, those are the things that I will see in my patients that have anorexia and bulimia. How do we treat these conditions? What can we do to help these individuals? Well, it's really important for us as nurses, number one, to be able to identify these behaviors and know what they mean. Again, if you see the patient preoccupied with weight, if you see these kind of purging behaviors, excessive exercise, those are all red flags. So how do we treat these patients? Well, we will look at cognitive behavioral therapy in addition to individual and family therapy. Treatment also includes nutritional support and sometimes anti-anxiety or antidepressant medications. We want to teach the patient to consider food as fuel for their body. That's going to be important. And we have to help the patient to come to grips with this dysfunctional thoughts and irrational beliefs they have about their self-image and that the relationship they have with food. So this is really, really important. And so with this patient that has an eating disorder, we can't expect for them to overnight to eat 3 square meals, right, with all their fruits and veggies. We have to do things gradually. And if you are looking at this, okay, how do I know my patient that has an eating disorder is healthy? In case you're looking at, at an NCLEX kind of concept, we're looking at their blood work. One of the primary things that we're going to do is look at their albumin. Albumin levels tell us the amount of protein that the patient has and tells us, okay, is their protein level normal? Okay, so that's going to be a key kind of NCLEX kind of thing. If you have a patient with an eating disorder or any patient that you think is malnutrition, the lab value that I'm going to go to first is one of the first is going to be their albumin levels. And then I'm going to look at their fluid and electrolytes. Are they dehydrated, right? So those are things that you have to think about, okay? We also want to reward their behavior, and those behaviors is, okay, you try to eat some of your meal. I saw that you ate 10% of your meal today. That's a great job. I acknowledge that, right? So you want to make sure that you take a positive approach. You never want to reject this patient, okay? Now, we really have to be mindful because eating disorders are often hidden from others and they may be reluctant to share specifics related to their behaviors and feelings. The nurse must be accepting, caring, and non-judgmental and establish a therapeutic relationship with this patient that has an eating disorder. That is essential. Nursing interventions should help to stabilize the patient. That is always the goal, to stabilize the patient. Okay, so let's go to the next slide. And yes, there's going to be therapy, behavioral methods, relaxation techniques, trying to help calm and alleviate their anxiety. And again, there may be the medications, anti-anxiety medications, antidepressant medication, but these are always combined with therapy, individual therapy, group therapy. We always want to make sure that we are looking at that. So let's take our eating disorders and let's take a look at it in terms of the nursing process. Always think in terms of the nursing process. We must assess our patient. What does this patient with an eating disorder look like? Again, remember to be therapeutic, non-judgmental as you collect the information about the patient, their height, their weight, their vital signs. You're going to be looking at their skin, their hair, is it dry, brittle, their nails, okay? All of these things are essential. Lab values, again, albumin is going to be very important. For your female patients, we're going to ask if they are of an age of having menstruation. We're going to find out, do they have regular periods? Because if they don't, that could be a big red flag. Because again, if a patient doesn't have adequate nutrition, that means that they're not able to, if they're of a childbearing age, to really carry a developing fetus or support a fetus. They may be tired. What's their sleep levels or their energy levels, right? So all of these things are significant that the nurse has to assess, again, non-judgmental therapeutic way, okay? And so once we collect this data, and that also includes their height, their weight, their BMI, we're going to focus on these specific nursing things. So we're looking at altered tissue perfusion, dehydration, we're looking at diarrhea, fluid electrolyte imbalance, hypotension, right? Hypovolemia and vomiting. So we really have to look at these things, and these are like your nursing diagnosis, right? And so we also have to look at the fact that the patient may suffer from anxiety, activity intolerance, right? Because they don't have enough fuel for their bodies. They may have altered body image, low self-esteem, and chronic low self-esteem. They may be at risk for constipation because we know when patients are dehydrated, they are at risk for constipation, right? So they may have issues with feeding. Maybe they're not able to carry out their activities of daily life. They may be at risk for injury, right? Malnutrition risk. They may even be overweight, right? And that is more so with your bulimic patient. They may have situational, low self-esteem, and they may also have vomiting. So we have to look at our outcomes, right? Or what are the interventions we're going to implement to help the patient to have the best outcomes? So some of the common things that we want for a patient that has an eating disorder as far as goals go, we want the patient to be able to verbalize decreased fear and anxiety related to weight gain and the inability to maintain control. We want the patient to be able to consume adequate nutritional intake to meet body requirements for their height and their age. We want the patient to be able to demonstrate appropriate eating behaviors, and that means not, going into the bathroom stall and having a binging episode, right? We also want the patient to participate actively in maintaining their health. We want them to be able to be age appropriate and appropriate for whatever their physical condition is or the limitations that they may have. We also want the patient to verbalize a realistic view of their body image. We want the patient to be able to identify ways to maintain a healthy means of weight control. We also want them to make positive self-statements. And we also want the patient to have improved interpersonal skills in social settings. We want the patient to be able to have autonomy, right? So that they will be able to determine what they're able to do, what they're able to eat, right? In a positive, healthy way. Those are all important things that we want for our patients that have eating disorder. All right, so let's take a look at some of these questions. Pause the video and think about the answer, and then you can unpause the video once you determine your answer. So let's look at question 1. Tell whether the following statement is true or false. Anorexia nervosa occurs equally frequently in both men and women. Is that true or false? Take a moment to pause the video. All right, hopefully you answered false. Although anorexia nervosa can affect both men and women, it is often seen more often in women. And it really occurs, and we see it more prevalently in our adolescent females, right? As they are starting to go through puberty. And again, that is kind of linked to your social media, your body shaming, your cyberbullying, right? So it really affects girls middle school, high school age. That's when we start to see it. A lot of celebrities have come forward and talked about their struggles with eating and with body image. A lot of them are models. I believe Taylor Swift has come forward and talked about her struggles with body image and maintaining an appropriate weight and an eating disorder as well. So again, unfortunately, our society is doing this. If you're going to be working with your pediatric population, this is something you've got to look out for. If you're going to be a school nurse, if you're going to be working at CHKD, again, these are all things to look out for. Okay. All right. Question number 2. Tell whether the following statement is true or false. Binge eating disorder is another name for bulimia nervosa. Is that true or false? Pause the video. It is false. Binge eating disorder presents with many of the same overeating compulsions as bulimia nervosa, but does not involve the same purging behaviors. Okay, so that's important to understand. There's not the same purging behaviors. Now, binge eating disorder involves recurrent binging eating episodes during which the individual loses control over eating compulsion, like that seen in bulimia nervosa. These episodes, however, are not followed by purging. Ding, 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 that's the big key there. or the use of compensatory methods or excessive exercise. Individuals with binge eating disorder report similar behaviors, feelings, and thoughts regarding their eating episodes as those with bulimia nervosa. Some common feelings include a lack of control over eating, either being able to stop or the amount of food consumed. Eating alone as they are embarrassed by the amount of food consumed or feeling disgusted with themselves or guilt after overeating. The severity of this disorder is determined by the number of binge eating episodes they have in a week. Okay, so when we talk about that in your textbook on page 279, box 16.6, severity of binge eating disorder. Well, if it's mild, it's 1 to 3 binge episodes per week. If it's moderate, there's 4 to 7 binge episodes per week. If it's severe, if there's 8 to 13 binge episodes per week, and then extreme, 14 or more binge episodes per week. Okay, you may be wondering again, what are some of the signs of binge eating disorder? Remember, there's no purging, there's no compensatory actions, but the patient will not be able to stop eating or control their food intake, eating continuously during the day, rapid consumption of large amounts of food, hiding food in place and they're eating in secret, feelings of stress only relieved by food, eating even when they feel full, and embarrassment and feelings of disgust over the amount of food eating. Okay, so that's important with binge eating disorder. Okay, all right, let's go to our last question. Evacuation of the digestive tract by self-induced vomiting or excessive use of laxatives and diuretics is called, is it binging? Is it purging? Is it restriction or amenorrhea? Take a moment and pause the video and determine what you think the answer is. All right, the correct answer is purging. Someone with an eating disorder may follow episodes of binge eating with purging, a self-destructive method to evacuate the digestive tract. So again, purging can be through laxatives, it can be through diuretics, it can be through enemas, it could be through vomiting, okay? These are all unhealthy ways and eventually end up harming the digestive tract. Okay, but again, this is your patient that is having an eating disorder. So for chapter 16, we discussed 3 major eating disorders. The first one was anorexia nervosa. The second one was bulimia nervosa. And then lastly, the binge eating disorder. Remember, binge eating disorder is different from the other 2 and the fact that there's no purging or compensatory behaviors. This concludes chapter 16. Thank you very much for your attention, and remember to always think like a nurse. Thank you.